My primary doctor down in Clarksville was having me go to have a CT scan of my chest because I'm a smoker. For 3 years, they weren't making such a big deal about it. You know, just it's a nodule, you know, a growth. And I said, all right. And then finally, you know, when they said, you know, it's cancer, that's when it really, you know, hit me. And
Michael was referred to me from a pulmonologist near his home who has been observing a very small pulmonary nodule. Now, this had shown some recent changes, and there was suspicion that it might represent cancer, so he was referred to me in a clinic. My name is Jielin Yu. I'm a thoracic surgeon here at TriStar Centennial Medical Center. So the nodule was initially biopsied by one of our pulmonologists, Dr. Ventola, and the biopsy confirmed a lung cancer. Given the small size of the nodule, it's about 6 millimeters, it would be difficult to locate at the time of surgery. And our goal is to perform a surgery that spares as much of the lung tissue as possible while achieving a cure. In order to do that, I asked one of my colleagues, Dr. Baah, to mark the nodule using a robotic navigational bronchoscopy.
Before a lesion or a tumor or a spot of this size, we were just watching. You know, now if the lesion looks suspicious and the patient has the risk factors, we can biopsy it and get a diagnosis, which means that we can refer these patients for surgery sooner, and that's where we come into play again to be a part of that collaborative effort for the patient. My name is Dr. Samantha Baah. I am a physician at Interventional Pulmonary of Nashville. What we do is we go in and we do the robotic bronchoscopy again, and we locate the tumor with a little bit of dye, and we inject it so that the surgeon can see the lesion a lot easier. That way they're taking out just a portion of the lung and sparing healthy lung.
they care up here, you know, everyone, excellent, excellent. He talks to you, you know, he explains things, doesn't talk over your head, and, you know, just, he's more caring, you know.
It's always satisfying to see a patient do well after surgery, especially a successful surgery that's been able to offer them the best chance of cure for their cancer. These days, we are performing a lot of lung surgeries while trying to spare lung tissue. With the help of pulmonologists and interventional techniques, we're able to be a lot more precise with our lung surgeries and offer the same chance of cure, but less morbidity and an earlier recovery.